I'd like to welcome everybody today to our webinar, The Crucial Role of Health Departments in Reducing the Spread of COVID-19. I'm Ron Bialik, President and CEO of the Public Health Foundation. For those of you who may not be familiar with PHF, we focus on individual and organizational development and improvement, working a great deal with health departments and national partners and others to help all of us do the best we can to protect and promote the public's health. I'm going to turn this over for a moment to Nolan Gill for a few housekeeping items. Nolan?
Thank you, Ron, and good afternoon, everyone. Going over a quick housekeeping items for today's webinar. Upon entry, all attendees have been muted, and this webinar is currently being recorded for archive purposes for later use as well. And please enter any questions that you may have for the panelists and hosts in the Q&A section of Zoom. And then with all of those housekeeping items in order, I will hand it back to Ron to set the stage for the webinar and introduce our today's panelists. Thank you.
Great,
Ron.
Thank you, Nolan. So during today's webinar, we will be hearing from a variety of panelists who will discuss the important relationships health departments have with restaurants and other food establishments, how health departments can help restaurants and other food establishments reduce the spread of airborne diseases such as COVID-19 and influenza, and of course others, and why it's important for health departments to be assisting restaurants and other food establishments. While it's always important to stress why action is needed, it's equally important to provide some of the how action can be taken and how it can be supported. So we'll also be talking in the webinar about freely available resources and training that can help health departments in their work with restaurants. So our first speaker today is Corby Kummer, who is Executive Director of the Food and Society Program at Aspen Institute. Corby is also a senior lecturer at the Tufts Friedman School of Nutrition and Science and has been a restaurant critic of New York, Boston, and Atlanta magazines, as well as a food and food policy columnist for the New Republic. Corby had the vision to create the many safety-first resources that are helping restaurants reduce the spread of COVID-19 and other airborne infectious diseases. And thank you, Corby, for that. Next, we have Chef Russell Jackson, who is the chef and owner of the restaurant Reverence. Chef Jackson has appeared on TV shows including SF Chefs, Iron Chef America, and in the Food Network kitchens, competing for the coveted title of Food Network Star. In 2014, Chef Jackson moved to New York City, and in the summer of 2019, opened the doors to his most personal project and his first New York City restaurant, Reverence. Thank you so much, Chef Jackson, for joining us today. We also are delighted to have with us Dr. Sam Dooley. Dr. Dooley is a medical epidemiologist and infection control specialist who retired in 2020 after 32 years of service at the U.S. Centers for Disease Control and Prevention. Dr. Dooley is the principal author of the Safety First Guide designed to protect restaurant workers and customers from COVID-19. And wrapping up, we have Vanessa Lammers, who is our Assistant Director of Performance Management and Quality Improvement at the Public Health Foundation. Vanessa manages and directs a wide variety of public health projects related to immunization, infectious disease, environmental health, and public health accreditation. She also develops and leads programming to build the capacity of state, tribal, local, and territorial health departments. So I'd like to turn this back over to Nolan for a moment for a quick poll so we can learn a little bit about who's participating today. Nolan?
Thank you so much, Ron. Moving over into our poll, just to learn a little bit more about our attendees, I will launch this, and please take a few minutes to choose the correct answer for you, and then we will move on.
So Nolan, do we have enough people weighing in thus far? Can let us know the results.
I would say so. About 81% participated, and thank you so much for doing that. I will end the poll for us here and share some results. With over 50% of our attendees a part of local health departments, and spread out between nonprofit and attendees in the restaurant and bar industry as well. Thank you so much for your time and participating in that poll. And from here, I will hand it over to Corby. Corby?
That means I have to unmute. Welcome, everyone. I'm so glad you could join us, and I'm so grateful to Ron and Vanessa for bringing us all together as they have for months now with the wonderful training that Vanessa will be guiding you through. And I'm so fortunate that our guiding forces, Sam Dooley and Chef Russell Jackson, have come with us today and have come with us on the journey of the past 2 years. Next slide, please. So we started our safety first work at the Food and Society at the Aspen Institute, a policy program I launched and direct at the Aspen Institute, which is in Washington, D.C., despite the fancy name. What we wondered when lockdown began was, what can restaurants do for themselves, and how best could they adapt their staff management, expenditures on new equipment they hadn't seen coming, and how to keep shifts, supplies, balance sheets best adapted to suit the unpredictable by necessity changes in the rules and suggestions of their local and federal health departments, which so many of you today, we're so glad you've joined us, have been involved in making and working your best to provide the best guidance. Those needs that we began with haven't changed. The information, the pandemic, and especially the availability of vaccines have changed. So we assembled a panel of, first, the brilliant epidemiologist Sam Dooley, who works harder than any human being except Chef Russell Jackson to keep up with the news that all of you have spent the past 2 years doing your darndest to keep up with every day. We consulted with many of you, local health and environmental officers and associations, and we had real-world practitioners join our weekly committee meetings, including the global operations managers of 2 international hotel chains and members of the country's leading restaurant associations. We knew we didn't have to cover or change food safety protocols. That everybody had down. Localities had it. The restaurants themselves had their own training. We were not going to reinvent that wheel. We were only interested in COVID transmission in the very tight, close quarters of kitchens and dining rooms. Ventilation emerged as a key factor. This was a conviction we had very early in the process. Sam kept emphasizing it. And it only became more and more of a strongly held conviction and reinforced as different research confirmed the necessity of ventilation. Again, not changed to this day. We were lucky to have an international level ventilation engineer who's been very active in ASHRAE, the standard setting group that I'm sure many of you have been looking to for ventilation guidance. So our first set of safety first, which you see right here, had as our 2 main graphics, next slide please, a diner code of conduct, which we would ask diners to be very aware of. And this got enormous traction. Resi and other national reservation services would send it out and make it available. The first one was originally wear a mask and then be kind. And as vaccines came available, we adapted it to be vaccinated. These 2 graphics, this and the next slide, please, the COVID pledge that a restaurant could post in its window. And I'll say we were very fortunate that, just as we'd hoped, local health departments adapted these without the branding at the bottom to their own uses, made it available to food service establishments and restaurants in their localities, as we still invite you to do. So these changed as the factors of the pandemic changed, and we're willing to revisit them again, depending on advice and guidance. Surprisingly, so much of what the main messages we had, especially about vaccination and ventilation, as you see right here in the first 2 items, have stayed steady. They continue to stay steady, but we welcome all feedback on these because our main point today is, next slide, please, safety is back in the hands of food service workers and managers, just where it began. So that's going to have a lot to do with masking guidance and protocols for individual staffs, for individual restaurants. And we're hoping that many restaurants will encourage their workers to wear masks to protect the vulnerable family members, staff members, remove the stigma for everyone else, even as local mask guidances lift and vaccination requirements lift. We also, here's our ventilation basics, which I have to say, we hope all of you will read and use, because even though it's a one-pager, it took a year of weekly meetings with ventilation engineers to evolve this, and it's full of cheap, practical guidance for restaurant owners who have no control over their landlords, can barely afford to stay open, but there's a certain amount they can afford to do. There's real change they can make to improve ventilation in their own. And this is for offices, this is for retail stores, this is for tight quarters of every kind now, as there are constantly evolving conditions of the pandemic. Next slide, please. We also partnered early on. Here's our Food as Medicine Research Action Plan, just another example of a recent product, Food and Society. This was 2 years of work on nutrition interventions that many of you in your localities perhaps can use. The resource is right in the chat. And then we were lucky enough to partner with the Centers for Disease Control Foundation, which supports so much of what the CDC does. And next slide, please. They evolved their own Food Worker COVID-19 Health Safety Toolkit with insights about taking your own health in your own hands, to evolve a vaccination plan, to evolve a plan to keep your own health steady, including finding mental health resources near you. The CDC Foundation continues to be a very valued partner, as the Kresge Foundation was in leading us to the Public Health Foundation. But luck led us to Chef Russell Jackson. So Chef Russell Jackson has been one of the in New York. He's speaking to us from the east side of Harlem at a pop-up. What's it called up there? He can give us the new guidance. But he's has Reverence NYC, which was the first and perhaps only white tablecloth fine dining tasting menu restaurant operated in New York City by an African-American chef. He's been a leader of chefs of all kinds across the country, a very vocal member of the Independent Restaurant Coalition, but he's been unbelievably active, imaginative, and charismatic in urging all restaurant operators to protect their workers, their families, and their diners. He may not look like a trained tap dancer, but his ability to keep absolutely current will convince you that he is, and is apparent every day. Now he's in a new world, New York City, with a lifting of mask mandates and vaccination mandates, and he's going to tell us about what that's like today. Welcome and thank you, Chef Russell Jackson.
Unmute myself there. Thanks, Corby, as always. Truly grateful, and you speak way too highly of me and my shenanigans. So, and to say the least, it has been, I mean, for us, Monday is going to be 3 years, going into 3 years of the most difficult time that I've had in my career, in my 40-year career. As myself and my other friends, and those that we've had other seminars and speaking engagements with, not one of us ever trained a single day, thought about or imagined the type of gauntlet that we've had to survive through this last few years. It's changed the playing field in so many different ways. And one of the things that, as I got on board with Aspen and the Independent Restaurant Coalition and One Fair Wage, one of the core things that I always said was that we watched and witnessed our entire industry implode in less than 2 weeks, from the sense that it was not built very well, but very, very fragile, and very unstable. As we all know, it wasn't a surprise to any of us that it happened this way. But that we had an opportunity going forward to say, okay, can we and should we build it back better, build it in a different way that makes the most sense for all parties involved. With Aspen, I've had a very unique opportunity as a small business owner who bootstrapped and self-financed my restaurant, which, you know, again, to most of my peers' amazement, what I was thinking, I'm still wondering myself, how I could try to MacGyver my way through all the difficulties that were ahead, that we were going to have to work through. And I was very fortunate that, again, with Sam and Doug Mass and the others, to be able to have very open and earnest conversations about what was happening, also in how some of the crazier things that I was thinking about doing would actually work for somebody that didn't have money. So from or didn't have the resources that were necessary to make it safe. I mean, full transparency, I have a young child. I'm 58 years old. I had a child right as I opened the restaurant, and he's going to turn 3 at the end of this month, and it's unvaccinatable to this point. So I'm always thinking about him, and by extension, my staff, my clients, my vendors, everybody that comes through. And that as a hospitality person, we always think about leading with love and leading with kindness. So this is second nature for us, to be willing to do what's necessary to take care of each other. But it's also had an immense difficulty in the respect that we're all under duress and scrambling to try to figure it out. Some of the protocols and the programs that we put into place, there have been lots of elements of trial and error. And as we all can know, the whiplash that we've gone through in dealing with the ever-changing landscape, not only from knowledge of the knowledge of the virus itself and its issues around it, but also how we were going to respond to it, what things we needed to put into place that were going to make sense and didn't make sense. Like, we very early on, of course, realized that taking temperatures wasn't a very good way of responding to this. And for us, in practicality, we were still being asked to report it here in New York, and we did, in trying to do it the most mindful way, but it was just really a waste of time for us. I can truly say this with now the current changes that have just occurred here in Manhattan, where they've taken the guardrails off, and that we don't have masking. They're not even asking us any longer to comply with showing vaccination cards or anything else. It's a little preemptive, but this is my personal opinion. I think it's a little preemptive, and a little. It has. I can truly say, on the ground here in New York, it has created a lot of chaos. Lots of restaurateurs don't know how to talk to their staffs about dealing with the current changes and stuff. We do look to our local health departments to give us guidance. I know that with New York, it's been a process in getting information out and transparent in a way that makes sense. And I know that there are people on the ground that we've seen that have come through our restaurant and asked us and talk with us, and that exchange of information, the way that I in being a new New Yorker and having dealt with the health department my entire career in California, there's always this immense fear when the health inspector walks in. Everybody freaks out. And I think that over this last year, now they show up and you're not freaked out because you know these people are going to come in and have a conversation with you about the things that you're trying to do, and also not being chastised about what you're not doing or what you should be doing, but how together you can figure out how to make your business work and be safe. And again, we tried to provide those tools to be simple and transparent and not red or blue or political, just common sense and easy solutions for people to be capable of doing. If you're here from a health department, I just ask that you lead with kindness and realize that, again, I'm a small restaurateur. I have a 12-seat restaurant, but the weight on my shoulders is no different than my 300-seat restaurant. I am, you know, I have the 1,000-yard stare going most of the time because of what I've been through and what I'm still going through on a daily basis. So be loving and embracing, and know that we want to work with you guys to make sure that we're here tomorrow, and that our customers are here tomorrow, and that our staff is healthy and happy. And I can truly say it's worked. My staff, from the beginning, not one of us got COVID. Not one of us got sick. Yes, we did have 3 third-party scares that we went into our protocol, shut down, and were never missed a day of operation. And we stayed operating from the minute they told us we were essential. So we were only actually closed for 2 weeks in the initial shutdown. And then we've had, you know, as the surges have come up and down, we've stopped. And the only other thing I would probably throw out would be that when surges do come through, we started building, and maybe I'm talking a little out of school here, Corby may scold me for this, but we did test a test to dine protocol, which we worked with several testing companies that helped us to be consistent about, and we do in-house testing for my staff. Every time if somebody's away more than 48 hours, they come back in, they get a test. And then we offered tests to all of our customers when they came in. We still offer them. It's not a requirement, but we as restaurateurs, or my staff, we all still wear masks. We will for the foreseeable future. And we all are staying with our testing protocols because, again, I have a 3-year-old. I don't want to kill him. And I want to make sure that the rest of my staff are happy, healthy, and productive. So I'm grateful to be here and happy to answer any questions.
And we're grateful for you. And I would love to solicit robust chat and robust Q&A about Russell's brilliant Test to Dine program, which we really worked hard to evolve. At the beginning, there was no availability of rapid tests. Russell was thinking of renting a car to go down to Florida, Mississippi, or Texas, where the 2 shipments he ordered off Amazon were blocked. Now there's an excess of supply because all of these mandates are lifting, and we still think that to offer diners and restaurant workers a real measure of confidence and safety as people come in unmasked to dine, that showing a negative test that's within 48 hours is a viable strategy. So we would love your ideas about this and whether you would ever consider mounting one in your locality. Russell,
yeah, we even still do, even for our vendors, our downline suppliers, if they come through, the delivery guy, if he doesn't have a clean mask or whatever, we offer them any of the protections that we have in our staple to make sure that they as well feel safe, because again, we're all in this together.
Indeed. And the person who is, thank you, Russell, you've inspired everybody to be incredibly careful and loving. And now we have Dr. Sam Dooley, our resident epidemiologist, a genius and guide. And he'll tell us something about the challenges of applying professional epidemiological techniques and studies to a very unpredictable pandemic. Sam.
Thanks, Corby. I'm really happy to be here. Glad so many people have joined us. I'd like to start by acknowledging state and local health departments throughout the country for all the work that they have done to protect all of us throughout the course of this epidemic. I think there's been a lot of attention given to the hard work and sacrifice of frontline healthcare workers, the work of folks in health departments. The frontline workers of public health is perhaps a lot less visible, but it's no less critical. I know that attention and personal accolade is not what motivates them, but they deserve it nonetheless. I think it goes without saying that this epidemic has been especially challenging for restaurants for many, many reasons. For many of the same reasons, it's been challenging to develop guidelines to help those restaurants reduce their risk for COVID transmission among workers and diners. Just a few of these reasons would include a continual lack of data and information to actually make the best evidence-based recommendations, a continuing evolving understanding of how COVID is transmitted, coupled with an initial reluctance to accept the role of airborne transmission, continual evolution of the epidemic with the occurrence of multiple waves of transmission and appearance of numerous virus variants that have different characteristics of transmissibility and severity, ambiguous and inadequate guidance from the federal level, confusion and controversy over what interventions are effective and appropriate for reducing transmission, and great variability in the epidemic at the local level, such that what's needed at any given time in one place is very likely to be different from what's needed at the same time in another place. You could ask why we're so concerned about restaurants in particular, and I would say the reasons are many, but just a few of them. Restaurants bring together large numbers of people, often relatively small, crowded spaces. Restaurants, especially those with bars, are characterized by lots of social interaction at close range, especially when alcohol gets flowing. For diners, interpersonal encounters in restaurants are relatively long duration, generally an hour or more. For restaurant workers, even longer. Diners are not masked when eating or drinking, which constitutes a high percentage of the time that they're actually in a restaurant. And restaurants are often inadequately ventilated for preventing transmission of airborne pathogens. And all of this adds up to a very high potential for transmission. You could also ask why we are continuing to be cautious and concerned at this point when vaccine is widely available. Cases are rapidly declining in most, if not all, areas, and the epidemic seems to be in retreat. And the reason is very simple. We have no reason to believe that this epidemic is over. There are still numbers of people who are either incompletely vaccinated or not vaccinated at all. Preventive interventions like mask mandates are being greatly relaxed or eliminated altogether, as Russell in New York. New COVID variants continue to be identified, and it's reasonable to expect that one or more of these variants will cause future waves of transmission. So I think we can all agree there's plenty of reason for continued caution and concern. It hasn't really been feasible to develop truly evidence-based guidelines for reducing transmission risk in restaurants for the simple reason that many questions that need to be answered can't be answered with available data. So the Safety First team has attempted to develop what I guess you might term evidence-informed guidance. We've approached reduction of COVID transmission risk in restaurants from an infection control perspective with two key assumptions. First, that most COVID transmission occurs through inhalation of virus-containing aerosols and particles from the air by susceptible people. That is, it is airborne. And second, that the same model that underlies infection control in healthcare settings, that is the hierarchy of controls, is equally applicable to restaurant settings. As I don't need to tell you, the hierarchy of controls includes three basic elements. Those are source control, administrative and environmental controls, and personal protective equipment. The safety first guidelines and training, which I highly recommend to you, and which Vanessa Lammers will be explaining in more detail, go into each of these elements in detail. So I'm not going to go into that type of detail about them here, but I would like to just touch on each of them briefly. First, source control, identifying and excluding or removing from the restaurant people who are likely to have COVID. Being equals no. Screening of restaurant staff and diners for recent positive test or diagnosis of COVID, recent symptoms, and recent possible exposure to someone with COVID. All simple, inexpensive, and straightforward. But there remain a lot of unanswered. Should we be taking pictures on site for unrecognized fever? Does it really make sense to require vaccination, exclude people who are not vaccinated, when vaccines are poorly effective at preventing infection, and vaccinated people who are infected can transmit infection quite efficiently? Should we be requiring documentation of a negative COVID test before admitting people to the? Does it make sense to test people with point of care antigen? There's skepticism about this because of the relatively low sensitivity of these tests. But actually, this is based on misunderstanding that test sensitivity is what matters, when it's really the predictive value of a test that matters. And that varies a tremendous amount depending on the prevalence of infection in the local community. And when you actually run the numbers, it appears that on-site rapid testing might add considerably to other screening methods when community prevalence is in an intermediate range. But exactly what that range is not so clear. And even if that's the case, does on-site testing add enough value to be worth the cost and inconvenience? What can health departments do to help restaurants with screening? Well, the intensity of screening depends entirely on current local, not national conditions. And it would be very helpful for restaurants to have clear, simple screening recommendations that are based on current local conditions. And it would probably be very helpful to them to have standard protocol templates to use so that each restaurant wouldn't need to invent its own. I know that health departments may already be providing these tools, but if not, they'd certainly be a helpful addition, I think. How about the second element of the hierarchy, administrative and environmental control? Well, administrative controls basically amount to clear written policies and procedures and rules of behavior that address things like whether restaurants should be providing on-site service or limiting themselves to takeout service. If on-site service is being provided, should it be limited to outdoor dining or should it include indoor dining? What masking and physical distancing requirements are appropriate under local circumstances? What should be the front of house procedures for greeting, seating, serving, and payment? And what do you do when an exposure occurs? Most of these things, at least in the past, have been foreign to the restaurant world, although, as Russell also explained, they've come to the fore in the past couple of years. Environmental controls involve ventilation and ultraviolet germicidal irradiation. and physical layout of the restaurant, things like spacing of tables and seating and location of cough and sneeze barriers. Ventilation just itself is enormously complicated, and it needs to accomplish three things. It needs to accomplish dilution of room air with clean air, either fresh or filtered, needs to accomplish removal of droplets and particles that contain active virus from room air, and it needs to control the direction of airflow. Accomplishing these three ends is complex, and it can involve natural ventilation with fans and windows, use of local ventilation units like through the wall or mini split air conditioners, whole facility HVAC systems, high efficiency air filtration, location of air supply diffusers and exhaust vents to control the of airflow, use and strategic location of supplemental portable air purifying units with high efficiency particulate air filters, upper air ultraviolet germicidal irradiation units, or any combination of these. And obvious that few, if any, restaurants are going to have the knowledge and expertise needed for designing effective ventilation solutions. So what can health departments do to help restaurants with these types of interventions? I guess something to mind would be providing clear, simple recommendations based on local conditions for the type and level of service that should be provided, for seating capacity, for masking and physical distancing, providing standard templates for policies and procedures that restaurants can use rather than each restaurant having to invent its own, providing standard signage or templates for signage that restaurants can adapt to support administrative controls, and providing, likely facilitating consultation on ventilation and ultraviolet germicidal irradiation, as well as physical layout of restaurants. If these things already exist, that's great, but if they don't, providing them would, I'm sure, be a welcome contribution for the restaurant world. The third element of hierarchy of control, the one that undeservedly seems to draw the most attention, personal protective equipment like masks, I think has already been beaten to. I'm not going to address this than to say that there remain many misunderstandings on this topic, and there's apparently still a need for clear, simple guidance on types of masks to use for personal protection, how to use them, when to use them, all based on local current conditions. On the whole, I think that if I were a restaurant owner or manager or worker, I'd like to have one location I could go to find everything I need to know, so I'm certain I'm doing the right things and not have to spend hours or days searching the internet for information on my own and still not know what's right and what's wrong. Maybe this would be an easy to find, easily accessible, restaurant-specific website that includes a simple, straightforward measure of the current local level of transmission in my local community, clear, straightforward recommendations on what precautions my facility should be taking based on current local risk level, information on how and where to access consultation on critical topics, and downloadable versions of standard policies and procedures, protocol, signage. Seems like it should be simple to find these things, but in developing these guidelines, it has taken us an immense amount of time to find these, and lots of the websites that are available from national agencies are very difficult to navigate, and it's hard to find this kind of information easily. So that's a lot, but here's the thing. We are all focused on COVID right now, but in fact, COVID is not really the issue. The issue is what is going to happen when, not if, but when the next epidemic of respiratory illness. I would say that in a sense, we've been really lucky because actually COVID is not a very bad virus. A really bad virus would be airborne. It would be highly contagious. It would have a relatively long pre-symptomatic interval during which it is highly transmissible. It would produce severe clinical illness that requires medical intervention and hospitalization. It would be highly lethal. It would be able to rapidly develop new variants that are able to evade control by vaccines. So I would say, picture a virus like HIV, but make it airborne. That's really what we need to be worried about. Conditions worldwide are moving in a direction that increases the likelihood of another pandemic. We were woefully unprepared at a national level for COVID. Our national response has been slow, clumsy, and poorly coordinated, and state and local health departments have taken the brunt of the assault. I don't think that we can count on being so lucky the next time, and we certainly can't afford to be as ill prepared. And on that grim note, I'd like to hand over the virtual microphone to Vanessa Lammers, who is the Assistant Director of Performance Management and Quality Improvement at the Public Health Foundation. Vanessa?
Thank you so much, Dr. Dooley. I don't think that was a grim note at all. I think that was the call to action for all of us, that although we have spent all of our time and energy over the last 2 years to address COVID, neither is COVID over, and also neither are we yet prepared for the next pandemic or the next influenza or respiratory disease to hit our country. So with that, I hope that we can present some resources and information and tools that are available to all of you today to help you move forward with Dr. Dooley's amazing call to action. So with that, I'll take the next slide. Thank you so much. So as Corby mentioned at the beginning, PHF joined this team of bandits at a certain point to take all of the really amazing guidance and information and science and evidence and research that was compiled by this team and this committee, all of the work that was done to create a set of modules for health departments on helping restaurants reduce the spread of COVID-19. So these are video-based modules. There are 3 of them that I'll briefly walk through. They're engaging, they're interactive, they have knowledge checks in between, and they also have pop-ups of the resources, all the resources that Corby mentioned, as they're mentioned through the modules pop up so folks can access them. And like Dr. Dooley, I just want to highlight what he just said about making things easy. We try to make the access to all of these resources easy. And then also for folks who are accredited, have any kind of accreditations through the National Environmental Health Association, thank you, NEHA. They provided 1 credit hour for this training, so you can self-submit to NEHA if you're accredited for any of their certifications or credentials. And then thank you to Dr. Dooley, to NEHA, to ASTO, and to NACCHO for advising us on this, this training, which is made available through the Train Learning Network. Next slide. If you are not familiar with Train, Train is the trusted leader in providing training and other learning opportunities to public health, healthcare, behavioral health, and preparedness, and other health professionals. It has been the go-to place for COVID-19 training throughout the pandemic. It now has over 3.5 million users. So we put our training exclusively in Train in the case of this, because it's where the people are, it's where they're going to get their CEs and they're going to get their trainings. It also allows for tracking of course completions, allows us to get some great feedback from users, which I'll share in a moment, and is free for users. So if you're on this webinar and you do not have a Train account, please head over to train.org, get a Train account now and take this training. Next slide. So the training that we developed has 3 modules. I'm not going to rehash these here, very much following the items that Dr. Dooley was talking about today. So source control and infection basics, we're keeping the source out of restaurants, controlling the source, keeping any kind of infectious disease from spreading, dealing with ventilation, and then also tackling the tough conversations of vaccination and vaccination communications. As Dr. Dooley just mentioned, some of this might be new or novel to both health departments who work with restaurants, and then also with restaurants. Maybe restaurants, it could have been the first time just a year ago that they sat down and said, well, maybe we should ask our employees about their vaccination status. Is that okay? So we walk through some of that information here. Next slide. And I just want to highlight separately the importance of ventilation right now. Like Corby mentioned, in the environment where we are dropping these mask mandates and these protections, we have significant information that's been made available through Food and Society program about ventilation, and that PHF has turned into a short 6-minute module, highly digestible for anyone that does not have any background in ventilation, to learn about what you can do in a space to increase ventilation, to reduce the spread of COVID-19, viral illnesses, and then thinking about the next pandemic, the next flu season, the next respiratory illness that may come along. What we can do is invest in our ventilation and our infrastructure, and ensure that when the next time that this situation happens, or the next time we have an outbreak in our restaurant or in our school or in our workplaces, that we have improved ventilation than we did in March 2020. So with that, I really encourage everyone to check out this module. And we do have 3 hosts for our training that are food inspectors and environmental inspectors from the Tulsa Health Department in Oklahoma. So thank you so much, Tulsa. Next slide. I just wanted to share a couple of comments from training participants who have taken this training through Train, indicating that if you're part of environmental health, this is incredibly important. If you're working with restaurants, you're doing restaurant inspections, environmental health inspections, so that you have this information going into it, you feel comfortable having these discussions. We really work to make this accessible, easy to understand. There's closed captioning, the resources pop up again, and it provides a lot of knowledge that is important for restaurants, but can also be used in other places. Next slide. And throughout this slide deck, which will be made public, we have included all of the key resources that have been mentioned so far. So again, the training is available through train.org. All of the resources that Corby walked through are available. And then we have additional immunization resources if that's new for you, or you're interested in learning more about immunization communications. PHF has an immunization center where we do resources and trainings that are available there. Next slide. So with that, I know I've seen a couple of questions come through so far, but feel free to drop your questions for the panelists in. We definitely have a few minutes for Q&A. And it looks like we have a question that already has come through for Chef Jackson. So Chef Jackson, you talked about a new relationship with the health department. So not only as a regulator, but as a partner and educator, do you see this role being sustained or even expanded?
My hope is that, again, this is a fresh start for all of us, and that the health departments will think about, again, it's a symbiotic relationship, just as it is with our downline vendors and suppliers and our customers, that it's a new set of circumstances that we're all trying to navigate, and that having better, more open communication is going to be part of that key. And again, I mean, it sounds trite, but leading with that thought of how can I do better? How can I help these people? How can I be of service? I always think that, and I always end that, like, how can I be of service to you? Lead with love. Just care. I mean, it sounds easier than it has been. And I think that the health departments have such a unique and incredibly cool opportunity right now to be the saviors and the guiding light for so many of us that have been so horribly confused, because it is chaos. I mean,
Yes.
it's a chaos. It's such a mess, and there's so much information coming. And we need to, through all of this, restaurateurs have needed to lean on those systems that are supposed to be there for us, like the health department, like the city and the state government. And unfortunately, lots of pieces fell apart very, very quickly. And the health departments get to stand up and be the rock stars right now and say, hey, here's what we're going to do to help you figure this out. And here's how we're going to try to make it a little bit easier for you. Here are what the new rules are. Here's what the new paradigm is. Get in line and we'll give you some time to figure it out. So, yeah,
I think I love the idea of a fresh start. And I know we have mostly health department staff on this webinar right now. I absolutely agree. This is a time where health departments are still the trusted voice in their community. They're still the place where restaurants are looking to. They want their questions answered by people who work in public health and who work at the health department and in our local and state governments and tribal governments and territorial governments. So yes, thank you again to all of our health departments on the call.
And again, it's not like, as we learned in Aspen, we didn't have all the answers right away, and that we had to work together and lean on each other to help to figure it out. And sometimes go to and obviously go to lots of outside sources to ask more questions to figure it out together. And that's in, it's like again, it's a symbiotic relationship. We need the health departments need us. And we have to, from a very human level, just work together and not just follow a handbook, because if y'all didn't figure it out, the handbook went flying out the window the first week. And it's a whole new set of circumstances. So yeah.
Great time to write a new handbook. It looks like we have another question for Corby. It's great to hear that the Food and Society program stepped in to assist restaurants throughout the pandemic. Do you see a continuing role around other person-to-person transmitted diseases where your program may be of assistance now or in the future?
I thank you for asking, and I didn't even write that question. We definitely see a role for continuing to help restaurant workers and food service workers, since we are called Food and Society, navigate their way through, and we hope beyond, the pandemic. And we're absolutely committed in working with the CDC Foundation to help workers evolve their own health plan, find the health resources in their locality next to them, what services are offered free, how to get assistance with mental health and other challenges that have come up during the pandemic, but how to get food service staffs to work better together and to work to preserve their own and their colleagues' health. So we are continuing to evolve all the guidelines around safety first. We welcome your feedback about the new priorities you're hearing and you feel you need help in emphasizing to the food service establishments in your locality. And we're going to be updating both safety first, thanks to Sam Dooley, because he has nothing better to do, as you can tell. He's so amazingly on top of everything, and our whole guidance committee, and also the CDC Foundation Safety Toolkit. So yes, we are already really proud of ventilation around respiratory illnesses. And I think that all offices, you've seen this in your locality, every workplace knows that ventilation just has to be a key to making workers feel comfortable going forward. And so our ventilation guidelines continue to be a resource that we're always updating with, we hope, the least expensive and most effective changes that office workers and restaurant managers can make to help ventilation in their own workplaces.
Excellent. Thank you so much, Corby, for really stepping in and taking the lead on all things food and society during this really challenging time, and for bringing PHF in. We have absolutely loved working with you all and are so proud of everything that we've done together. And I just want to thank our amazing panelists today for joining us, taking your time to talk to health departments about your communities and what you're doing to protect everyone right now. With that, I will ping it over to Nolan to close us up.
And Sam has his hand up.
Yeah, I just wanted to say, you know, health departments have stepped forward incredibly during this epidemic, and I'm hearing us. We've asked a lot of health departments. I'm hearing us in this webinar asking a lot more of them, but I think we have to acknowledge that this epidemic has stretched them thin. And even before this epidemic, they were, with few, if any, exceptions, seriously under-resourced. And I think we depend on their help in dealing with the epidemic, but they also depend on our help in advocating for them to be adequately funded and resourced. I don't think that the need for that can be overestimated.
Thank you, Dr. Dooley, and thank you for all the attendees and panelists today for joining PHF and the Food and Society program at the Aspen Institute for today's webinar. We hope this has been helpful in exploring how health departments can partner with restaurants to keep both diners and staff safe in reducing the spread of COVID-19 and other viral diseases. This recorded webinar will be posted on PHF's website, as well as all the links to the resources discussed today within the next coming weeks. So with that, thank you everyone so much, and we hope that you have an amazing rest of your afternoon and week.